Plus, spring break is upon us on this Friday. A lot of people have taken yesterday, today off, and that's why we're seeing lighter than normal conditions out there for your commute. But for millions of Americans, that's going to mean travelers, airports, road trips, beach destinations, you name it. But before you pack your bags, there are a few health precautions you should know about. Joining us on Live Impact News on WCNC Plus is Dr. Elexander Atkinson from Novant Health. Doctor, thanks for joining us here this morning.
Absolutely. Thanks for having me.
All right, so what is happening around right now? What's circulating and what should we most be worried about right now?
Right now, we're pretty good in numbers. We're not seeing a ton of COVID, flu, RSV, but those still are kind of the bigger players. There's hundreds of viruses out there, so there's always something circulating, and we don't always do the testing to identify exactly what it is. And then we're also seeing a fair amount of probably norovirus that's causing a GI bug, basically some diarrhea and vomiting. So a little bit of face stuff and then a little bit of GI stuff.
All right, so knowing that that is out there a little bit, what are the important things that people should know to protect themselves before they get to the airport or on a plane?
Yeah, so prevention's always better than a cure, right? So we want to make sure we're washing our hands, soap and water, hand sanitizer. So if you're traveling and going to be in public areas, make sure you have some hand sanitizer. That's going to be the best thing for you. Try not to touch your face too much, and then don't touch straws or things like that. So trying to just good hygiene there. If you're immunocompromised or if you're going to be in a very crowded area, not a terrible idea to still wear a mask. I usually do wear a mask myself if I'm going to be in an airport, especially during busy times. So simple things like that, just to kind of keep the bugs away from you, is going to be the best bet.
Why is it important to stay hydrated? I mean, every day, but particularly when you travel.
Well, so with travel, especially with air travel, when you go up in the airplanes, the air is very dry, so that dehydrates you. So you're going to be more dehydrated or have a higher water demand than normal. Uh, Probably won't have as much of a water demand if you're just driving, 2 or 3 hours staying at a similar elevation. But if you're going to change elevations, then you get dehydrated as well from that. So that's important. But just in general, you want to stay well hydrated. That's important for your kidneys, important for your immune system, and things like that.
Absolutely. And let's talk about vaccines. If people do have time to get a vaccine before they travel next week, what should be on their list?
I always recommend whatever the guideline recommended vaccines are. An important one to think about that sometimes people forget about, especially adults, is their tetanus shot. Tetanus actually protects you from pertussis and diphtheria, both of which live out in the community. We can't completely eradicate it, so important to think about that, and pertussis being whooping cough. So sometimes if you have kids in school and you get that letter that says there's been a case of pertussis or whooping cough, be on the lookout. Tetanus really protects against that, but there's other ones like RSV vaccines, pneumonia shots, flu shots, and things like that that you should make sure if you qualify for them, you should stay up to date on those.
What a great reminder, because I just had my physical last week and he told me to get my tetanus shot. So thank you for that. I'm going to schedule that. As far as packing, obviously you want your own prescribed medicines, but what else should we be thinking of, doctor?
Yeah, so your own medicines, if you have an allergy and you need an EpiPen, don't forget your EpiPen. That's never a fun experience to need it and you don't have it. I usually tell people, depending on where you're traveling, right? If you're going camping and you're going to be out in the woods, you probably need a bigger first aid kit than someone that's traveling to Atlanta and is going to be in a hotel next to a Walgreens where they can go buy what they need. But I usually tell people, let's make sure we pack things like allergy medicine like Zyrtec or Claritin, ibuprofen, acetaminophen, so a little pain medicine if you take melatonin to help you sleep. So those types of things you want to make sure you pack, some alcohol swabs, Band-Aids, basic first aid things. So at least kind of the basics, and then depending on where you're going, how many people you're with, and your other health concerns, you kind of expand the first aid kit from there.
Certainly nobody wants to go to the hospital or emergency room while they're on vacation. However, sometimes you have to, right? So, doctor, when should you when does someone stop trying to push through whatever they're going through and then just go to the medical professionals?
Yeah, I would say if you would go to the doctor when you're at home, that would be kind of a good sign that maybe I do need to go to an urgent care or an emergency room. Obviously, if you have something life threatening or you're very sick, you should go to the emergency room. If it's just like I've got some sniffles or I've got a few symptoms, I don't seem to be getting better, I'm worried, if you have a good primary care doctor that you have a good relationship with, what you could always reach out to them and say, hey, is this something I can wait? Do you have any advice? Do I need to go get seen? Things like that. So you kind of have to make a judgment call on, can I get some advice and wait for the advice, or do I need to be seen now to kind of get an answer and get some treatment?
That's when that concierge medicine comes in handy, which I don't have. But anything else? You know what? How about coming back home sick? Do you stay home for a while? Again, do you just push through and tough it out?
I would say use your same judgment that you would use if you got sick any other time. The important thing is we don't want to be spreading this because that's how you got it. So if you got it from someone else and then you go to work and you give it to all of your customers, clients, or other coworkers, well, you just kind of spread the joy. So if you can stay home, that's better. If you absolutely can't, there's always going to be, other things we have to consider besides just medical advice, right? So washing your hands, wearing a mask, asking people to stay away from you if you can. But I do worry about people that, are more customer facing, food service facing. Please, follow Department of Health Services guidelines. If you're sick, don't go to work and spread it to all your customers.
Right. And please wash your hands when you leave the restroom. That goes for everybody, right? For those who are lucky enough to go to a beach or a resort, Dr. Atkinson, I know we hear about sunscreen, but what are the basics? What are the rules?
Oh, yeah. Oh, a big topic, but let's go through some basics. So first, 6 months and up is usually what I say for babies before we start putting sunscreen. And we want to patch test on any kids, any new products, and even year to year, you may want to patch test. So just a small quarter size area on the thigh or the low back, not on the face. See if they have a reaction. So we should be doing that before we get to vacation so that we know which products are going to work well for us. You want to be careful with which products we put near the face. We don't want to cause eye irritation. My preference is a mineral-based sunscreen over a chemical-based sunscreen. Those have like titanium or zinc dioxide. They reflect the sun instead of taking the UV and kind of absorbing it. The issue there is they tend to wash off faster. They're a little thicker and need that kind of white smearing. So some people don't like that, but that would be my preference is the mineral-based sunscreen. Those are also the ones that are considered safe for like reefs and things like that.
All right, very good. Anything else that we should know about before we head off out there on the yonder?
Well, just be safe. It's important to remember that, especially in the younger populations, it's not usually medical problems that end up in people having severe disabilities or deaths. It's accidents. So seatbelts in those cars. If you're going to be riding bikes, if you're renting bikes on your vacation or scooters, put a helmet on. Don't get on them if you don't have a helmet. Making smart choices like that.
Smart choices bring you back home safe. All right. Thank you, Dr. Alexander Atkinson from Novant Health. Appreciate the time and great reminders for the spring break vacation for everybody. All right. Enjoy, everybody. Thanks.
Thanks.
And we'll be right back here on Live Impact News on WCNC Plus.